I am live. I am reading Many Lifetimes. It's a study by Joan Marshall Grant and Dennis Kelsey, her husband, one of her husbands, who wrote together this book. It was published in 1967, um, and it is a collaboration between these two, going through various cases. They were both hypnotherapists in their own way. Chapter 3 was Joan Marshall Grant talking about the supraphysical, and we are now the supraphysical in medicine by Dennis Kelsey. I believe that the concept of the supraphysical body, as Joan has formulated it, contributes to our understanding of the mechanisms involved in a variety of medical phenomena, which are by no means confined to psychiatry. An example of one of these occurred a year or two before I met her. I was talking with Mr. John Barron, the plastic surgeon, about the problems involved in fixing patients in the sometimes curious positions required for the purpose of transferring skin from one region to another, when I recalled it performed by a certain stage hypnotist. He would hypnotize members of the audience whom he had invited onto the stage, cause them to assume bizarre positions which would normally be exceedingly uncomfortable, and leave them there while he carried on with the remainder of his act. When mobility was eventually restored to the living statues, they would sheepishly declare that they had kept their position without any conscious exercise of will, and without the least discomfort. It occurred to me that it might be possible to apply the same principle to some of these patients. Mr. Barron replied that he had a case under his care at the moment who might prove a perfect subject for an experiment. The patient was a young man who, in an accident, had lost the forepart of his right foot. In order to cover the stump of the foot with skin, which would withstand a reasonable amount of wear and tear, it was necessary for an area of skin to be brought down to the foot from the abdominal wall. The procedure was going to need 5 separate operations. The first step would be to fashion an area of skin on one side of his abdomen into a tube, which would remain attached at each end to preserve the blood supply. Then, as soon as it was apparent that the tube was healthy, a matter of a week or two, the next stage would be to free the upper end of the tube from the abdomen and stitch it into a site on the left forearm. Thus, for the next few weeks, while the tube was establishing itself in this position, the patient's arm would be linked to his abdomen by the tube, and during this period it would be vitally important that his arm did not move, for any movement might exert tension upon the tube. The next stage would be to sever the lower end of the tube from the abdomen and insert it into a second site on the left wrist. After this operation, the patient's arm would be free again, but it would be carrying the tube of skin, looking rather like a large looping caterpillar. Then, when the tube was clearly thriving in this situation, it would be possible to undertake the next and most crucial stage. This would involve detaching one end of the tube from the wrist, and then having the patient place his left hand in a precise position on the top of his right foot, so that the free end of the tube could be stitched along one margin of the stump. It would then be necessary for the patient to remain in this position for several weeks, for not only until the tube had again become well established would it be safe to detach the other end, also from the wrist, open the tube up, and apply it to cover the whole of the wounded area. The patient agreed enthusiastically to the experiment, and so we decided that for the second stage, during which his left forearm would be linked by the tube to his abdomen, we would rely upon post-hypnotic suggestion to fix his arm in a position. The effect was remarkable. Not only did the arm maintain its position with a complete accuracy, but when it was released some 3 weeks later, there was no stiffness whatever in the fingers, wrists, elbow, or shoulder. Encouraged by this, we decided to use nothing but post-hypnotic suggestion at the fourth stage to fix his hand to his foot. And we were able to tell him that so long as the precise angle at which his hand had been placed on his foot remained unchanged, he could move in any way he liked. Again, the technique was astonishingly successful. The hand never budged on the foot, and the patient was perfectly comfortable throughout the whole period. The fact that one hand was stuck to a foot caused him no inconvenience. It scarcely seemed to register on his consciousness. Moreover, he developed an astounding agility, and as he could do everything for himself, he made minimal demands upon the nursing staff. But the most gratifying feature became apparent when, after 28 days, the pedicle was deemed fit for the final operation. I hypnotized the patient again. The pedicle was detached from the wrist, and I gave him the signal to unlock himself. Immediately he had full movement in every joint without a trace of stiffness anywhere. He could arch his spine backwards like an acrobat, and he could manipulate a cigarette lighter with the fingers of his left hand. There was simply no need for psychotherapy to overcome the sort of stiffness which would almost certainly have developed after weeks of immobilization by any mechanical means. I would not anticipate a similar result on every patient who happened to be a good hypnotic subject. I am sure, in retrospect, that the essential factor responsible for success in this case was the very effective link this patient had between his supraphysical and his physical bodies. There was another point which I think supports this view. As a rule, when two skin surfaces are in contact for a period of weeks, the sweating which occurs between them usually causes the skin to become soggy and unhealthy. But the skin on both the palm of this patient's left hand and on the top of his right foot was perfectly normal. As sweating is a function which is not under conscious control, I think its absence in this instance can also be attributed to the efforts of the supraphysical body. The concept of the supraphysical body offers, as Joan has remarked, a credible rationale for the process of so-called spiritual healing. In this connection, the supraphysical may be likened to a magnet that is placed beneath a sheet of paper upon which have been scattered some iron filings. The lines of force traveling between one end of the magnet and the other will draw the fillings into a definite pattern and hold them there. Similarly, Similarly, the energy of the supraphysical maintains the particles which make up the physical body in a definite pattern. But one of the function as well as the structure. Disease or injury disturbs this pattern, and healing represents the effort of the supraphysical to bring it back to normal. Medicine and surgery in the ordinary sense concentrate on trying to minimize the task which the supraphysical has to perform, perhaps by remedying a lack of some vitamin or hormone or other essential substance, perhaps by giving a drug which makes it impossible for bacteria to proliferate, perhaps by exercising a tumor or by fixing some injured part in the most favorable position for healing to occur. But it would seem a rational procedure also to supplement the energy in the supraphysical, and I think there is considerable evidence to suggest that this is possible. My personal experience of healing in this way is not extensive, but I will quote three instances. One occurred when Joan slammed the door of the car on her left forefinger. The pain was intense, and discoloration appeared immediately. I would have expected swelling to occur very soon and for the finger to be out of action for some days. We happened to be in the depth of the country, so I pulled the car off the road and told Joan to shift level. Then I clasped her finger in my hand and concentrated, first on making a vivid mental picture of its anatomy, the skin, the bones, the nerves, the blood vessels. Then I asked her to let the pain flow into my hand so that I can throw it away. After some repetition of this, she declared that her finger was free of pain. At that point, I tried to visualize myself literally driving energy into her finger to accelerate the process of healing. It would be scientifically indefensible to claim that anything happened as a result of my efforts. But the fact is that the finger did not swell, gave her no further pain, and suffered no loss of function. In the course of writing this book, we visited some Swiss friends who live in Bern. As they were also friends of the surgeon Leo Eckermann, I took the opportunity to watch him perform several operations. In the middle of one morning, I came back to the house to find that our hostess had just returned from having a wisdom tooth out. The extraction had been unexpectedly difficult and was performed under a local anesthetic, which had now largely worn off, so exhausted and in considerable pain, she had gone to bed. Learning that she was allergic to aspirin, I offered to try to help her with hypnosis. She proved an excellent subject and quickly reached a deep state. I followed the same technique which had apparently helped Joan. I first placed a hand on her cheek and urged her to let the pain flow into my hand so that I could throw it away. Then I made a mental picture of the tooth socket with its blood clot in position and visualized driving energy into it to hasten the healing. Finally, I told her that within a few moments her state would change to one of her normal sleep, which would last for an hour, and left her. A little later, Dr. Ekman arrived at the house. I explained what I had done, and then, since the hour was almost up, we went to see the patient. She awoke as we entered, and the change in her appearance was remarkable. She was completely free of symptoms and felt so full of energy that she insisted upon getting up and resuming her normal program. She suffered no further discomfort from the extraction, and the socket healed unusually quickly. This patient's well-being so impressed Dr. Ekman that he invited me to attempt to repeat the procedure upon a patient from whom, on the previous day, I had watched him remove the lobe of a lung. This patient, a man of 60, was ready to extend to me the supreme confidence he had in his surgeon, and readily entered hypnosis. I placed my hand on the bandages over his wound, and asked him to let the pain flow into my hand. It was interesting to note that his breathing, quite spontaneously, became deeper. Suddenly he coughed, opened his eyes in astonishment, and exclaimed, "But it did not hurt." Then I made a mental picture of the structures in his chest wall, which had been divided during the operation, and imagined myself driving in energy. I'm told that this patient made an uneventful and unusually rapid recovery. I must emphasize that these cases carry no scientific weight whatever. The most that can fairly be said is that they support rather than detract from the validity of the concept of transferring energy to the supraphysical body, and innumerable other therapists could relate more impressive experiences of a similar nature. At present, very little is known about the essence of the factors involved in the interaction between two personalities. But if it were to become generally accepted that there are levels of reality other than the one which can be perceived through the five senses, such matters could become the subject of unprejudiced research. Then I suspect laws would be discovered which govern both the transmission and the reception of the energy involved in healing, and orthodox medicine would be enriched by the addition to its armamentarium of techniques, which at present are too open to charlatans. The concept of the supraphysical body as a distinct element of the personality is important to the understanding of reincarnation, and will also, I believe, prove valuable in psychiatry, in that it may help one to direct therapy more precisely. The point was illustrated by the case of a young man who was suffering from increasing anxiety. For the first few sessions, Joan and I saw him together, but his story was so rich in the sort of emotional and conceptual material which often underlies this symptom, that we did not suspect that an earlier personality might be involved. For this reason, I soon continued the therapy without Joan's assistance. But as the weeks went by, although ventilation and discussion of this material were bringing him certain benefits, such as improved relationships with his family, his anxiety was not diminishing. And then a session occurred in which I had a curious experience. When I feel uncertain of the direction of the next step during a course of therapy, I sit for some moments with my eyes closed and my body completely relaxed. I find that in this state I very frequently get a hunch, which quickly proves of value. But on this occasion, instead of a hunch, I got a very vivid mental picture. I saw a young woman who I knew intuitively was the patient wearing a blue dress which belonged to a period of at least 100 years ago. She was sitting in front of a mirror, smiling at herself and obviously enjoying the reflection of her teeth, which were remarkably white and even. I recalled then that the patient had told me of an incident which had occurred shortly before his anxiety state had started. He had been in a bar where a fight was on the point of breaking out, and a youth had come up to him and said, "I'm going to kick your teeth in." My patient declared that he was not normally averse to a roughhouse, but these words had caused him literally to feel faint, and he had bolted. He had been ashamed of what he called his cowardice, but also bewildered by it. As he put it, he was only a little chap. I could have eaten him. I regarded this episode as, at most, merely the trigger which had precipitated his illness, and had attached little importance to it. But now, taking into consideration also the fact that the patient's teeth were quite unusual, well kept, and regular, I realized that it might be one of significance. Support for this idea came when I asked him if he often had to visit the dentist. He blushed at the question and then admitted that the idea of anyone touching his teeth filled him with such repugnance that he had never been near a dentist. A week later, Joan entered the story, and about 5 o'clock this patient's relatives had telephoned to say that on going into his room that morning, they had found him deeply unconscious from a large overdose of sleeping pills. The local doctor, who had been with him most of the day, had just left, satisfied that the danger was over. The patient lived 60 miles from London, and as he was now asleep, there was no point in us going down to see him that night. As Joan knew that I would not be free until at least 8 o'clock, she decided to do a level shift alone, to try to find out what had been going on in his mind. When I went downstairs after my last patient left, I was alarmed at what I found, being not yet familiar with the effect on her of a particular difficult identification. She was obviously in acute pain, and tears were pouring down her face. Her mouth was half open, and she managed to tell me that she dared not close it because to do so would increase the agony of her lacerated gums. I can feel the blood clots in the tooth sockets. It was bad enough during the first 2 days after he pulled out all her teeth, but then the taste got worse and worse, not only dead blood, but pus. Then the fever started, and she died on the 4th day, but she forgave him before she died. It was half an hour, though it seemed infinitely longer before Joan became sufficiently detached to give a coherent account of what had been happening. She had identified with the woman of whom I had had a mental picture during the last session, with a patient more quickly and completely than she had expected to be able to do so. The period was the 3rd decade of the 19th century, in the country of Somerset, in the west of England. The woman was about 18 and had married a much older man because he was the most prosperous farmer in the district. He was so besotted with his young bride that she was able even to refuse him his marital rights on the excuse that she was too young to have a baby, which would spoil her pretty figure. She was renowned for the excellence of her teeth, for at that time scurvy was prevalent, and few adults had many teeth left. She enjoyed smiling at young men as much as they enjoyed being smiled on. Her husband's jealousy steadily increased, until one night, in a fury of rage and thwarted sex, he flung her onto the bed and lashed her wrists and ankles to the corner posts. Joan thinks his original intention was only rape, and that his wife drove him beyond the brink of sanity by mocking him. He ran to the stables to fetch the pincers, which he had used for extracting nails from the hooves of his horses. He used this instrument to wrench out all her teeth. Joan presumed that the patient had been the farmer, and that his reaction to the threat to his own teeth had been based on the fear of retribution for his savagery. She hoped that he would be very much better that she had relieved that now that she had relived the experience for him. By the following evening he had recovered sufficiently from his overdose for his family to bring him to see us. It was immediately apparent that he was no better at all. He was still acutely agitated, and I had no doubt that, given the opportunity, he would repeat his attempt at suicide. I therefore arranged for his admission to a private nursing home. When we visited him the next day, he seemed no longer to be suicidal, but was still acutely agitated. He repeated the story of that incident in the bar over and over again, laying particular stress, as though this explained everything, on the fact that the youth had approached him on his right-hand side. John told the patient about her level shift, but the story left him completely unmoved. At our next visit, he launched yet again into an account of the episode in the bar, still laying stress on the fact that he came up on my right side, you see. This reminded Joan that the husband had stood on the right-hand side of the bed, and she realized that the patient had been, not the husband, but the wife. The effect upon the patient of this news was dramatic. He had not the slightest difficulty in accepting the entire story as valid, and by the end of the session, his anxiety had vanished. I did not expect that this degree of improvement, I did not expect that this degree of improvement, which had occurred so suddenly and, so far as the patient was concerned, so smoothly, would persist. I fully anticipated that by the next morning he would have slipped back, at least a little. But on the contrary, we found him completely calm and very cheerful. On the following day he was equally well, and it seemed unjustifiable to keep him in the nursing home any longer. I telephoned to his family to collect him, warning them that they should remain alert to the possibility of a relapse. However, all this happened more than 5 years ago, and so far his anxiety has not recurred. I make a break here. Today is Thursday, the 29th of August, 2024.